Warm welcome to this video. Now, autism rates we've just learnt in the United States in 8-year-olds are up to 3.22%. And a large proportion of these have severe intellectual disabilities, what we'll call learning disabilities in the UK as well. And I suspect with a lot of you that a major international scandal may be about to be revealed. Not immediately, perhaps starting in September this year. Certainly by the end of 2025, I would expect we're going to know dramatically more. But let's stick with what we know for now. Now, here is the autism prevalence here. Now, we see back in the 60s, it was 1 in 10,000. Then it's gone up progressively, 2004, 2006, 2008, 2021, 2023. Actually, the 2023 data is 1 in 36. It is now gone up to 1 in 31. This is a complete epidemic of autism. So what is causing it? Well, diseases can be caused by endogenous factors. Now, these are basically genetic factors, and it wouldn't change so quickly, so we can rule that one out. While there might be a genetic predisposition in some individuals, this is not what's causing this pandemic. And I think we can also pretty well rule out sociological and psychological things. This is due to some environmental cause, some environmental toxin. I've ruled those out so quickly because this is a biological disorder resulting in intellectual disability as well as all the features of autism. This is a complete tragedy for millions of families around the world that is going on at the moment that wasn't there in the past. This is a new phenomena. This is a new epidemic. So could it be a food? Potentially, yes, or a variety of foods. Environmental toxins? Yes, quite possibly. Could it be iatrogenic? Now, the Greek word for doctor is iatros. So iatrogenic means that which is caused by the iatros, the doctor. Could it be drugs? Could it be other factors? Could it be a cocktail effect? Almost certainly it's going to be a cocktail effect. It's a case of what environmental factors are interacting to cause this increasing disaster that we have in the United States. And if you're in the UK, we'll see it in a minute, we're not that far behind, unfortunately. Not far behind at all. Now, this comes from here. This is the source. Let's just look at that. We always want to check the references. That's from this paper here, from the US Department of Health and Human Services. So this is what we are quoting from government communications in the United States. All eminently readable, by the way. Feel free to check it out. So Washington, D.C., 15th of April, 2025. Autism prevalence in the United States, 8 years of age. 2021, it was 1 in 36 children, totally appalling. 2022, 1 in 31 children. Now, I know what you're saying, it's 2025. It's preposterous that the data is so delayed, completely unacceptable. And I know Robert Kennedy is actively working on that now. I would expect we're going to get 2023, even 2024 data in 2025. They are working on that. Anyway, what we now have is 1 in 31 8-year-olds with autism, 3.22%. This is a complete, it's a catastrophe. It's just an appalling situation. Now, US Health and Human Services, HSS Secretary Robert F. Kennedy Jr. says this: the autism epidemic is running rampant. I agree with him. 1 in 31 Americans born in 2014, as we say, checked in 2022, are disabled by autism. Now look at the term there, disabled. The amount of disability varies quite significantly, but for some children it is really quite bad, as we'll see in a minute, especially if it's associated with intellectual disability, which many cases are. That's up significantly from 2 years earlier and nearly 5 times higher than when the CDC first started running autism surveys, children born in 1992. Now, let me just show you where this data is actually coming from. The primary source of this data is this report here, which we can see is from the Centers for Disease Control. and they're comparing it with data from this report here from the year 2000, and it does check out. I've checked this out. It does. Everything here does check out. And again, this is completely readable. The figures are there. You can download it in PDF. I must say, very well presented, readable report, albeit 3 years late. So that's the main reference there. Prevalence for boys is an astonishing 1 in 20 in California. And in California, no, it's an astonishing 1 in 20, and in California it's 1 in 12.5. So in California, 1 in 12.5 boys has autism, 1 in 20 overall. Of course, autism is always much more common in boys than in girls. President Trump, this is RFK talking, President Trump has tasks me with identifying the root cause of childhood chronic diseases, the epidemic, including autism. So all the chronic diseases in children, including autism. We are assembling a team of world-class scientists to focus research on the origins of the epidemic. Now, I know this is true. I actually know some of the individuals that have been assembled. World-class people. People that we've interviewed on this channel are going to be involved in this. Some of the leading, well, Paul, I think we can say the leading doctors, epidemiologists, mathematicians, statisticians in the world are going to be involved in this for the simple reason they're going to be employed by the American government, and they will find things out. I'm not too optimistic. Well, they're hoping to find things out by September. I think that's optimistic. I think it depends how quickly they get rid of the dead wood. Now, of course, people have been appointed at senior positions, but there can be people further down the food chain in relatively senior positions who knows, might want to obstruct the release of data. Who knows? Some of them might have vested interest. Who knows? If that is the case, there could be potential obstruction, and it could take longer for data to be released. Let's hope not too much data has been mislaid. And we expect to begin to have this answer in September. Again, yes, begin, I think that's true. End of the year, end of 2025, I'd be more optimistic, depending on any obstruction within departments. If the will is there, the scientific expertise to analyse this with full rigour, with the full might of the American administration is now there. And of course, once they find out what it is in America, the same is going to be true in the United Kingdom. We are going to find out the answer to this. What is this toxic, exogenous, environmental cocktail of interventions and toxins that our children and who knows, pregnant women are exposed to that's caused this appalling situation? And even when they find out the cause, I think all that's going to do is reduce the new cases. I think it's going to be very difficult to find out how we manage the cases we've got, because once the brain's damaged, it's difficult for it to recover. So this is going to be ongoing throughout the lifetimes of our current generation of 8-year-olds. It's an appalling situation. I hope I'm wrong. I hope they do discover some radical new cure, but not yet. Right, the new Autism and Development Disabilities Monitoring Report, ADDM, conducted in 2022 across 16 sites in the US, surveyed children aged 8 born in 2014. Autism prevalence in 2000, 22 years ago, 1 in 150 children. Now, 2022 data, 1 in 31. Quite appalling. 4 times 8 increase. 2022 compared to 2020, as we said, 4.8 times higher, nearly 5 times more. Not percentage, times. Increased intellectual disability amongst those affected. Percentage of autism spectrum disorder cases with lower IQs has increased. Nearly 2/3 of children with autism spectrum disorder in 2022, from 2022 data, had either severe or borderline intellectual disability. And again, this is going to make the prognosis much worse. Basically, any psychological, psychiatric condition, if there's low intelligence, it reduces the prognosis. And just to give you an example of that, IQ of less than 70, which is really quite significant intellectual impairment, just to give the first 3 states. IQs of less than 7, 31% of those with autism in Arizona, 43.3% of those in Arkansas, and 28.4% of those in California. So these are the percentages of those diagnosed with autism spectrum disorder who have an IQ below 70 IQ points, which is really quite a significant reduction in intellectual capacity. So whatever is causing the autism is also basically having this massive effect on the brain of huge numbers of children, meaning that they never intellectually develop. You know, these kids with IQs of less than 70, they're probably never going to have a job. I mean, just think of the economic considerations there, apart from anything else, apart from the human tragedy. Prevalence of autism spectrum disorder by sex. So boys, it was 49.2 per 1,000, girls 14.3 per 1,000. So as we see, more common in boys. Getting on for 5% of boys in the United States. I mean, this is just phenomenal. Getting on for 1 in 20 boys. Well, as we said at the start, 1 in 20. Male to female prevalence 3.4, which is about what we see in the UK. It's fairly similar. Now, prevalence by ethnicity in 2022 in 8-year-olds. Interesting. Black children, 3.66. Asian children, 3.82. Hispanic children, 3.3. White children, 2.77. Now, of course, this will not have been lost on the epidemiologists that are going to be examining this. They will take meaning from that. Have the white children, for example, got high levels of vitamin D? Do they have access to more iodine? Vitamin Bs? Is there some it gives you a real insight into possible environmental factors, because we have these differences, and this is how the epidemiologists can really start to get a handle on this. Severe or borderline intellectual disability. Again, black children, 78.9 of those diagnosed with autism had severe or borderline intellectual disability. The reason these figures are higher than these ones we've looked at is these were below 70. I think the borderline is people with IQs of 70 to 85 of an IQ score. So this will include those below 70 and those 70 to 85. And again, we see less white children severely affected in terms of intellectual disability, but still over half. This is still a complete and utter tragedy. This report exposes a series of critical public health crises, a persistent rise in autism spectrum disorder prevalence, it's still going up, an alarming escalation in case severity, the level of autism and the level of intellectual disability is sadly increasing stark disparities across racial and ethnic groups, although the hope is that this could be a way of getting into solving the problem. There is also highlighted the urgent need for real-time data. To be talking about 2022 data in April 2025 really is laughable. But Robert Kennedy is getting onto that. Other things that RFK has said, the autism epidemic has now reached a scale unprecedented in human history because it affects the young. Absolutely correct and tragically correct. The risk and costs of this crisis are 1,000 times more threatening to our country than COVID-19. I would say, well, more than 1,000, but he's being conservative there. Because this is going to be going on, as we say, potentially for the lifetimes of these children. Autism is preventable. I agree. We need to find out the cause and prevent it, because it never used to be there. This is a new disease. Not new, but it used to be phenomenally rare. Now it's phenomenally common. There is a cause. We will find it out. This will be found out soon. Within the next year, this will be found out. Autism is preventable, and it is unforgivable. I so agree. Unforgivable that we have not yet identified the underlying cause. Why on earth not? But we are going to now. we should have had these answers 20 years ago. I just couldn't agree with him more. The procrastination, it's enough to make you think that there's vested interests involved, although of course we couldn't possibly know that. UK, also a dramatic rise in autism. Now, I did look at the government, the NHS site, and I must say I couldn't find any data at all on their spreadsheet. Maybe I'm just not very good at spreadsheets, so I scrubbed that. And I went on to the Priory Group, who did a lot of good analysis on this. This is their analysis. 2024, boys 2.8%, girls 0.65%. So a bit behind the States, but not that far behind the States. But we can add to this that basically 200,000 referred in the UK waiting for diagnosis in 2024 because the health service hasn't got around to it. So if we added a couple 100,000, of course, those percentages would go up. Between 1998 and 2018 in the United Kingdom, we've got nearly 8 times more autism. So 7.5, 8 times increase in autism between 1998 and 2018. What could possibly have increased in, what exposure could possibly have increased in that time? It gives rise to a 7 or 8 times increase in the prevalence of autism. And everything needs to be on the table here. We need to think about everything. 2023 study, this is in the UK again, people aged 20 to 49. Probably 500,000, up to 500,000 in England may be autistic, but undiagnosed, potentially. Antipsychotic medication is prescribed to 2.1% of autistic children and young people. That concerns me. Is it because they are developing psychotic symptoms? Most antipsychotics in the UK are actually instigated by psychiatrists rather than general practitioners. So psychiatrists really would only prescribe antipsychotics. Not very often. They would prescribe them outside of psychosis. So is there an increasing psychosis? That would be a concern. Use of antipsychotics increases with age, unfortunately. Now, rates of co-occurring bipolar disorder in autism. I wasn't aware of this, or not fully aware of it. So there's an overlap between autism spectrum disorder and bipolar disorder. Sort of mood variation, manic depressive disorder, cyclothalamic disorder. It has different names where someone alternates between periods of potentially mania or hypomania, more likely to be more prolonged periods of depression. And the concern here is that bipolar disorder, cyclothalamic disorder, manic depressive disorder, whatever you call it, want to call it, it's all the same condition. It's in the psychotic range of psychiatric disorders. It's not a neuroses like environmental reactive depression or reactive anxiety. It's in the psychotic range. Psychosis, neuroses is where the environment affects the mind, like anxiety and depression. Psychosis is where the mind affects the environment. It's a disease of the mind, probably the brain. But sadly, we see bipolar in autism. 7.8% of those with ASD in children have bipolar disorder. In adults, it's 15%. Pretty big overlap there with a psychotic disorder, which is concerning. Now, just final word, the Brownstone Institute. I'm not going to tell you what the title of the article was because I want you to be able to see this video. That's about, so they're talking about various factors. That's how much taboo there is around this subject, which is in itself deeply strange. So there is taboo. You'll notice that I've been very cautious as to what I've said because I want you to see this video. There's a taboo around even discussing this massively serious, multiple million tragedies, which in itself is deeply strange. Yeah, I would say that's deeply strange. If science is simply a matter of evidence and causal inference, it should be fearless and not doctrinaire. It should go where the evidence leads. I agree. We need freedom, complete freedom of speech to be able to discuss this so we can have a scientific dialectic. What's your idea? Well, this is my thesis. Well, here's an antithesis to that. Let's combine those. Let's come up with a synthesis. Let's go forward. through argument, debate and discussion. We need to be free to do that. And at the moment, we're not completely free to do that. But I think we can assume that the people appointed by Robert Kennedy will have more latitude than you and I do, because they'll have the authority of the US government behind them. And they will come up with an answer unless, as we say, there's internal obstruction within these departments. And I hope that can be rooted out and the dead wood chopped out, so that the departments might act as transparent lenses focusing the truth. Let me know what you think. But for now, let's just spare a thought for the tragic situation of so many families who had a perfectly normal 2-year-old only to have a autistic 3-year-old. Thank you for watching.